BPH stands for benign prostatic hyperplasia. Hyperplasia is a fancy Greek word that says your prostate's just getting bigger. And what happens is, as we get older as men, our prostates grow and grow and grow and grow. So the prostate sits beneath the bladder, and as it gets bigger, think about it like a donut or a bagel, because it's breakfast time and I'm always thinking about food. And as the prostate gets bigger, all that urine that your bladder makes has to go through the prostate and out to the outside world. So the bigger the prostate, the more difficulty you get getting rid of it. We have several different treatment options for BPH. Usually, if people don't want to do anything right off the bat, they can try medications, and there's different classes of medications, one being an alpha blocker like Flomex, or a 5-alpha reductase inhibitor like Proscar. And so what those medications do is just, again, relax the inside of the urethra or make the prostate smaller. And in doing so, then you have a much easier time going to the bathroom. At some point, maybe medications run their course, and then you're looking for something more procedural oriented. And then we have options for that as well. We can do something in the office like a UroLift or a Resume, which should be on our website, and we can talk about those options that are less invasive. We also have options like a plasma button transurethral resection of the prostate, or conventional TURP, TURP, transurethral resection of the prostate. There's also newer aquablation. And also there's non-surgical options such as prostate artery embolization, or PAE. Some of the classic symptoms are urinary frequency, and especially at nighttime. When people get up more than twice a night to urinate, that's a problem. Because, let's face it, if we want to go to bed, we want to sleep through most of the night. If we get up once, okay, maybe. But twice, 3 times, that's a problem. And really it's about, can I get started? Can I go to the bathroom? Am I interrupting my day-to-day activities? Am I sitting through a movie because I'm going so often? These are the bother scores that we look at. So there's something called a symptom score and a bother score that we assess when we look at it subjectively. And it's really, how much trouble am I having going to the bathroom? How much difficulty is it getting the urine out? That's a big one, because if we don't get urine out of our bladders, then bad things can happen. And even though we call it benign prostatic hyperplasia, it can actually be very detrimental to your health, when it starts to back up and potentially even cause you kidney failure. Well, I think if they get a bother enough to where it's really starting to interfere with their activities, they can make an appointment, come in, and let us work this up and just make sure it's nothing more sinister. We want to check a PSA, a prostate-specific antigen, make sure it's not prostate cancer we're dealing with. We will probably want to look inside the bladder in some cases to say, hey, what is the extent of this disease? Or measure the prostate, how big is it? So we can give you better treatment options. And then we'll run the gamut and tell you, here's what your options are. Whether you want to do something more medical or something more procedural. Just come in the first time and we'll just go through the workup with you and your options, and then we'll take it from there.